What role do kidneys play in electrolyte regulation? Imagine your body as a finely tuned machine, where tiny charged particles called electrolytes keep everything running smoothly. The kidneys are like the master regulators of these electrolytes, making sure each one stays just right. They do this through a complex process that involves filtering blood, reabsorbing what's needed, and getting rid of what's excess. This process happens in tiny structures called nephrons, which are the functional units of the kidney. Blood flows into the kidneys through the glomerulus, where it gets filtered. The filtrate then moves through the renal tubules, where the kidneys decide which electrolytes to keep and which to send out in the urine. Sodium and potassium are two of the most important electrolytes the kidneys manage. The kidneys adjust their levels mainly in the distal tubules and collecting ducts. When blood sodium is low or blood pressure drops, a hormone called aldosterone is released. This hormone signals the kidneys to reabsorb more sodium back into the blood, which also pulls water along with it, helping to increase blood volume and pressure. At the same time, aldosterone encourages the kidneys to excrete potassium into the urine to prevent dangerous high levels that could affect the heart and muscles. This balancing act is crucial because too much or too little of these ions can cause serious health issues. Calcium and phosphate are also tightly controlled by the kidneys. They filter these minerals from the blood and reabsorb or excrete them as needed. Parathyroid hormone plays a key role here by increasing calcium reabsorption and promoting phosphate excretion. This balance is vital for strong bones and proper metabolic functions. Magnesium, another important electrolyte, is mainly reabsorbed in a part of the nephron called the loop of Henle. Proper magnesium levels support enzyme activity and nerve and muscle functions. The kidneys also help keep the body's acid-base balance by regulating hydrogen ions and bicarbonate. This process influences electrolyte levels because maintaining the correct pH is essential for normal cell function. Water regulation is closely linked to electrolyte balance too. When the body needs to conserve water, a hormone called antidiuretic hormone or vasopressin signals the kidneys to reabsorb more water, which concentrates the urine and adjusts electrolyte concentrations accordingly. If the kidneys are not working well, as in kidney disease or kidney cancer, these regulatory mechanisms can become disrupted. This can lead to electrolyte imbalances such as high potassium levels, low sodium levels, or disturbances in calcium and phosphate. These imbalances can make managing health more complicated and can affect everything from heart health to muscle function. That's why the kidney's role in controlling electrolytes is so vital for keeping our internal environment stable and healthy. Always remember, if you have concerns about kidney health or electrolyte balance, it's best to consult a healthcare professional for personalized advice.